can handle some joint healing though. There's no doubt about that. That's not like easy to like. She's making that look way easier than it is. I'd be like, oh.
So with the hippotherapy, I've been using my right shoulder quite a bit to help kids stay balanced on the horse.
And you're kind of reaching, you're not on the horse with them?
No, I'm not on the horse with them. I'm on the ground, so my arm is up at their level. And just with the height of the different horses that we have,
it's an awkward position.
Yeah, it's just a weird position for my shoulder.
Yeah, that's tough.
And depending on the client, I can, switch to the left side, but that's not all the time.
So, hey everybody, it's Dr. Warren. You guys got to watch the laser treatment here. You do something really cool, which I learned about last time. Sorry if I'm talking too softly. It's called hippotherapy. I had to repeat myself a couple times last time. I was like, what kind of therapy are you doing? And she does, so it's like, let me have you explain it relative, but it's so cool that she's doing it, and I've heard a lot of this through the grapevine of working with people over the years of this like therapeutic approach using horses, and so talk a little more about hippotherapy.
So I'm an occupational therapist.
She's an occupational therapist, yeah.
And I use horses in my therapy to work on my clients' goals, so their therapeutic goals. Sometimes it's more mental emotional goals, and other times it's more of the physical and mechanical goals, just kind of depending on the client. And so I'm using the horse as a tool to kind of help me work on our goals in therapy. And horses and lots of other animals have great benefits to providing counselors therapies.
Yeah, that's awesome. So, using a horse to reinforce gait mechanics to somebody while they're walking on it, getting that rhythm and that feedback, like I don't understand the intricacies of that, but I've really heard that to be very beneficial. From a mental standpoint and giving that emotional release of connecting with an animal, and then you're working with kids too, so it's probably, you just see it unravel right in front of you. There's so much joy in that moment with kids, which is really special. I've heard a lot about that with people that are recovering from cardiovascular events too, people that have neurodegenerative disorders, and using horses to help aid in that. Kids or people on the spectrum, or with mental impairments or mental challenges, if you will. All those, it's pretty cool how many people you can serve. I love riding horses too. You can serve me too. I'm gonna come up there and get some hippotherapy.
Let's do it.
Let's do it. Oh my God, my daughter lights up on the horse. It's so cute. And so we traveled down to Costa Rica, and went to this beautiful place down there called Capos. And Capos is a little city. It's near San Manuel Antonio National Park, and went to Dominico. And just there's such beautiful areas down there. We go to the beach, and there's like a. I mean, this is probably like a. How old do donkeys get? I mean, he was up there, right? This donkey was 20s. Living his best life on the beach down there, though. But my dog, what was the name of that donkey? Like Clementine or something like that. And Scarlett lights up. It's like the most beautiful thing she's ever seen. This little donkey. And we get to the beach, and it's like, Layla runs to the ocean. I'm like, oh God, I can barely swim. Gotta go after that one. Scarlett's sitting there petting a horse, some wild horse on the beach. I'm like, oh my God, what's going on? Marley's asleep. It was wild. But so the guy's like, does she wanna ride? And I'm like, yeah, totally. She would love that. And she rode around on the beach for like 10 minutes, and she talked about it all day long. It was so cute.
Good.
Yeah. She had a great time. Oh, man.
She had her own hippotherapy.
She totally had some hippotherapy. And I know you're directing that, and I'm probably using that. We're using it loosely now. relative just to all horseback riding, right? But I know that there's an approach and there's a technique, and you're up in Baltimore County, right?
I'm in Howard County, yeah.
Sorry, you're in Howard County. Oh, you are? Okay. I feel like most of the farms around here are up in northern Baltimore County, so surprised it.
There's a couple people that do that, and it's awesome, and I'm glad that it's growing in interest because I think it's very beneficial. And so.
That's awesome. I appreciate you. Doing some trigger point therapy on the shoulder, on the rotator cuff, infraspinatus. I'm gonna get to the supraspinatus, the teres minor, and now I'm working on her upper trap because you'll find some of those reflexive trigger points in that area where she's straightening her shoulder. There we go. How do people find you if they want to use your services?
I have a cute website and a little social media page.
Carly's gonna tag it on the top comment here.
All right.
Yeah, so if you've got an individual or somebody that you think could benefit, or if you just want more information on it, check it out below. So you've been getting dirty on 3 times. We're gonna use some stim. You come to the room, we'll do some soft tissue work, some adjustments. Last time you were in, we did some sinus releases. You got the light therapy.
Yeah.
Sometimes I'll also dry needle in conjunction with the, I'm in a super tight spot. With the laser therapy, I'm going to the spine of the scapula. I'm working over the belly of the supraspinatus muscle, palpating the trigger point or sensory point. And here, pressure point, whatever you want to call it. Ashi point. Ashi point is in acupuncture. I think it means, oh God, they told me it meant it hurts here. But that's like a name for like a meridian point as well. A lot of crossover between acupuncture points and trigger point dry needling. Probably a reason for that. You doing well with all these so far?
Yeah, they feel good.
They feel good? Awesome. You let me know if it's too much. I'm trying to give you space and me space. Let me do this. I'm just matrixing myself. There we go. Just fanning the needle, just working the needle back and forth before I let her sit with these for 10 minutes. And it kind of looks wild, like to see a needle kind of sliding back and forth like that. And it's I'm on purpose doing that in the sense of creating some stress in the tissue. Lateral deltoid. But the needles don't cut, they push. They slide through the tissue. They're not beveled like you would get blood drawn.
Where's Eddie?
She can handle some dry needling though, there's no doubt about that. That's not like easy to like through. She's making that look way easier than it is. I'd be like, oh!
But I'll take it.
So working on the rhomboids, working on the levator scap, lateral delt, all these different tissues around the shoulder, pressure there. And then I'm going to hook up some stim to her as well, to the needles I should say, which will stimulate that tissue. It'll drive that endorphin response in the tissue a little bit more. There's pain relievers that come in with dry needling. I kind of equate it, the scientists of the world might refute what I'm saying, but it's just an easy way of understanding it. It's like adding heat to a chemical reaction. It's a little bit more work to that tissue in a positive way. So relative to that, let's get it working. Electrical stimulation is used a lot in physical therapy and in chiropractic care in different forms, and acupuncture as well. Acupuncturists tend to, and I use this in school, have like a little pen they'll hold up to it and stim one at a time. These are really, really awesome machines that we have here that do a great job of maintaining a good current. We're going to use a low frequency with her shoulder. It's not something that she injured yesterday. And so I'll set that frequency accordingly. So it'll feel like more of like, as opposed to like, one more of an acute setting, I'll increase the frequency like that. How did my stem noises sound to you, Kara? Was that spot on?
Yeah. Love a good sound effect.
Yeah, try. Alright, nice and easy. We're going to work the trap and supraspinatus first. You're going to feel a little thumping. We got some action there. Carly, check it out.
They're dancing.
What? You broke the fourth wall. Oh no, that's when you talk to them. Oh, you can talk away. You're good. I love when you talk. So we're going to turn that up a little bit more. Let me know when it's strong but comfortable. It's already kind of right there where I would like it. Do you feel good with that level?
Yeah.
Okay. Strong but comfortable, like I said. I want to don't want to be sitting back playing patty cake with these. We need some work done, but we don't want it to be uncomfortable. So we're going to go to the teres minor infraspinatus area, mostly teres group. You're going to start to feel a little stim.
Dang.
And I'm liking how that's moving right there too. You okay with that?
Yeah.
Do you feel that?
Yeah.
All right.
How could she not feel that?
You'd be surprised. Sometimes people don't. I'm like, okay, we need to turn this down. They're like, yeah, I don't even feel it yet. I'm like, your muscles are jumping off the table. So sometimes awareness in an area is different from person to person. That's a side story for another day. We're talking about hippotherapy here. We're talking about someone that's giving back to some people in a cool way, in a good way, and we're getting her ready for the big day.
Thank you.
Do some soft tissue work and adjustment next. You chill for 10 minutes, okay?
Thank you.